Great, thank you so much. So I'm going to go ahead and share my screen, and we'll get started with the presentation. Alrighty, would someone mind just sending me a quick message and letting me know if you are able to see the presentation at this point? Great, great. Well, thank you again for joining us. We are going to go ahead and get started. So today what we'll be talking about is the public charge rule. And today's presentation is brought to you by CASA, also known as CASA of Maryland. I, Lee Hopkins, am the Senior Manager for Health and Social Services, and I'll be leading today's webinar. And, oh, sorry, I'm getting a message that people want video. So let me just see how I can do that. And how okay. Can folks see video now? Okay, great. So I don't know, and then I'll go ahead and just also speak briefly about the Social Workers United for Immigration. I don't know if Cheryl is on the line yet. I don't see your name in the list, but go ahead and send me a quick chat so that I can unmute you if you are. Otherwise, I'll go ahead. Okay, let's see.
Yeah, no problem. I think other people will probably join. Okay.
Hi, Lee and everyone. Can you hear me?
Cheryl, yes. Are you there?
Yes, hello.
Hi, everyone.
Okay. If for some reason. Hello? The screen goes. Okay. All right. It's movie time. Yeah. I do have popcorn.
Okay, I'll go ahead. Sorry, we're having some issues trying to figure out the sound. So the Social Workers United for Immigration is a cohort of social workers who work in immigrant service agencies in a variety of sectors within the DMV area. And we are in the process of growth, which has been very exciting. We are affiliated with the National Association of Social Workers, DC chapter. We are also in the process of kind of figuring out how we will grow and expand in order to also incorporate advocacy opportunities into our core activities and goals. And we invite all on this webinar to join us. We can send out a follow-up email after the webinar, and please go ahead and join our group if you are not already a part of it. So let's get started. So today we're going to start with a history of the public charge rule and then speak about the current proposed changes, and then how can this impact our clients and communities in a concrete way so that we know what to expect and how to prepare. Then, since our audience today are social workers, we're going to go through a bit of an ethical framework, going through social work ethics and how that relates to our work with the public charge. And then finally, we want to talk about how you can make a difference in this issue and in this fight. And we'll just close with additional resources and time for questions. So, the public charge rule is an immigration rule that essentially was created in the 19th century against poor Irish immigrants, and it is meant to exclude certain groups of immigrants. So essentially, whom it is meant to exclude is any immigrant likely to become a public charge, which essentially means a financial cost to the government or society. And that individual, when determined by immigration to likely become a public charge, can be denied entry or permanent status. And I'll go into more detail about what those terms mean around entry and permanent status. The public charge has always been determined by immigration on a case-by-case basis. So just to reiterate, this is not a blank slate across the board rule that will be implemented in every case. It is assessed on a case-by-case basis, and that continues to be the situation. And then in the 1990s, it was updated and in fact more defined and more limited to only consider individuals who are receiving long-term care, SSI, and TANF to be considered potentially as a public charge, quote unquote. So currently, there are a lot of efforts to change the details of this public charge rule. Ever since the new administration began, we've seen multiple leaked drafts beginning in February of 2017, but it has not been officially implemented to its fullest extent yet. So the latest draft that we have been able to see, which was leaked, pardon me, it has not been officially published, was leaked in March 2018. It proposed denial of specifically permanent residency or family sponsorship and other types of work or travel visas. If anyone in the household, receives Medicaid, qualified health plans, which is ACA or Obamacare, where someone who may have unaffordable or not receive health insurance from their employer can pay a premium but receive a tax credit so that it's a more affordable amount every month. It also will include MCHIP, food stamps, WIC, and the earned income tax credit. The last draft we saw had all of those included. We also don't have a confirmation of this, but based on consultation with some of the legal experts on the national level, specifically National Immigrant Law Center, we have heard rumors that this could also include county and state programs. And so that is of particularly alarm as well. Some examples of those in this region would be, for example, Montgomery Cares in Montgomery County, Care for Kids in Northern Virginia and in Maryland, as well as Healthcare Alliance, which is a Medicaid type program for individuals in Washington, D.C. Now, the U.S. Department of State has already updated the Foreign Affairs Manual that they use for their guidance in overseas consulate processing. So that's if someone is applying for a visa to come to the U.S., whether it's for work, for tourism, for medical reasons, or to be reunified with family. Now, already since January, the Department of State is implementing this updated list of programs to potentially deny visa applicants from overseas. It has not yet been fully proposed and implemented for domestic processing, which is majority of what the communities and clients and neighbors and family members that we all have are predominantly in the U.S. would be going through domestic processing. So that is still pending. I'm just going to quickly look through and see if there's any urgent questions. Okay, let's keep going. So who can this change affect? This is not the entire list. These were just some examples that I wanted to share to get you thinking about how far-reaching the impact of this policy could be. We work, and in this community, we have a lot of mixed status families. And so while maybe not all of the family members have current opportunity to, or a pathway currently to apply for permanent residency, some family members may, and other family members may be receiving public benefits that they're eligible to receive because of their immigration status as well. So we're seeing a lot of that where families are, everyone in the family may have different statuses and therefore may be eligible or not eligible for different public benefits. But this policy, because it considers benefits received by anyone in the entire household, it can affect essentially anyone in the household in the long run. Also, parents of children receiving benefits, many of the members of our community, parents may not currently have a pathway to legal permanent residency, but their children may be U.S.-born citizens and are, eligible for a lot of benefits that they may be receiving. And so parents, with the hope that in the future we will have comprehensive immigration reform and they will be able to regularize their status to permanent residency, they may be at a crossroads of not wanting to risk potentially being separated from their children in order for their children to now receive public benefits such as CHIP or food stamps. We're also seeing this happening with situations of family sponsorship. For example, maybe a permanent resident or U.S. citizen spouse is sponsoring their partner, and if one or the other is receiving any of the benefits in the list, it could jeopardize that process. Similarly, if children, are no longer minors and are able to sponsor family members and parents as well. Similarly, if families are sponsoring relatives from overseas to get a visa, regardless of the type of visa that is, now this extended list of public charge guidelines will be used when assessing whether that individual will be eligible for the visa or not. And another example, because many folks in our community have TPS in the region in Washington, D.C., and Northern Virginia and Maryland, tens of thousands, over 30,000 people, I believe. And so those individuals may be getting a tax credit because they're working. They may be getting, they may have a qualified health plan, a health insurance premium. Their children may be getting Medicaid. Currently, our immigration system does not provide a path to permanent residency for TPS holders. But since we continue to fight for that, we are concerned that this population, by accessing the services that they currently are legally eligible to access, may be punished in the future. Then there is the much larger impact that we're concerned about, and that is the chilling effect that this policy and the rumors associated with it could have. Because we know that folks will do anything to not risk the unity of their family. And so we're concerned that even if families may not actually be harmed by the public charge expansion, they'll be worried that they would and may take steps to prevent such a situation. Now, I want to point out, because it's important, that this policy will not and has never in its history applied to individuals with refugee status, asylee status, U visa, T visa, VAWA, or special immigrant visa status. Another important thing to note, because there has been a little bit of confusion about this in recent press reportings, this only applies to individuals applying for a visa or permanent residency. It does not apply for individuals applying for citizenship. If you are already a permanent resident, it will not harm your chances of becoming a citizen. But we do need to remember that if not everyone in the household is already a permanent resident, then, similar to how I already explained, it could, the permanent resident and their use of benefits won't impact their opportunity at citizenship, but it could impact their family members' opportunities at permanent residency if they're able to sponsor them in the future. Alrighty. So how could the public charge rule impact clients and services? This could affect a large population in our region. Nationally, 25% of children have one or two immigrant parents, according to the Kaiser Family Foundation and community, I believe it's from the American Community Survey. And we know that that is definitely the case in our regions. We see that reflected. Also, DC, just to remind us all of how large and prominent and powerful our immigrant communities are in this region, Washington, D.C. has a 14% immigrant population, Maryland has a 15% immigrant population, and Virginia has a 12% immigrant population. Those populations are also highly centralized around the D.C. metropolitan area. This is a really important issue for our work and for our region. One impact, in addition, that we're concerned, not just looking at the scale of the population that could potentially be most directly affected, but also we're concerned about what will happen if families make the difficult decision to drop out from health insurance plans and publicly subsidized food programs. For example, without health insurance, what would happen is that folks, and without public food assistance, a lot of those same families will then have to depend on safety net clinic services, federally qualified health centers, and will not be able to provide health insurance reimbursement to those providers. They will have to depend, those patients and clients would have to depend on a sliding fee scale financial arrangement. And we know that that is a really challenging financial arrangement for many clinics, and that the health insurance reimbursements are an important part. Similarly, in publicly subsidized food programs, we're concerned that this will push more families into food insecurity and poverty and malnourishment, and put a greater need on the infrastructure of food, food banks and local food assistance programs. Also, as mental health professionals and social workers, we know that this situation compounded with all of the other discriminatory and anti-immigrant policies and the general many systems of oppression that many of our clients and communities and neighbors are walking through on a daily basis. This can increase risk of stress and trauma-related symptoms, which is harmful for child development, and it's also harmful for family stability. So, also, because we all are social workers, I wanted to discuss our NASW ethics and how those relate to the public charge. First of all, I went through the list and kind of picked out some that really stood out to me as the most relevant to this fight. So first is our self-determination. So in your work with families and clients, when the issue of the public charge does come up and these difficult decisions are having to be made, we encourage families to make their own decisions, whether to access programs or to drop out from them. We dissuade you from feeling that you need to give someone advice one way or the other. Families know their situations best. And so we encourage you to play a role in making sure that they are well informed and correcting any misinformation about the risks of the policy, but that families make decisions on their own, weighing the cost and benefits and real opportunities that they may or may not have for permanent residency down the line, and the risks and opportunities of staying enrolled in health insurance and receiving ongoing financial support and food support or not. Next is competence. We are all experts in a lot of amazing things. If this public charge rule is not your particular expertise, it is very complex It is determined on a case-by-case basis, and so we encourage you to refer clients to immigration attorneys for advice on their specific risks of public charge denial. An immigration attorney is the best person to be able to look over the entire immigration case and guide and have kind of also a knowledge on how public charge determinations are playing out, and to be able to guide the family best in what really the legal risks would be. So again, unless that is really within your area of expertise, we encourage you to refer to an immigration attorney. Thirdly, privacy and confidentiality has never been more important. We encourage you to take this opportunity to review and update how you keep your client records safe, and as much as you can, lawfully protect data from federal access, and in general, protect data from information sharing. The more you can protect data, and we encourage you to even share with clients how you are protecting their data, that will build trust. And it also will protect you from liability and feeling ethical dilemmas in sharing information. You know, let's use HIPAA as our guide. It has, and if there's guidance you would like, CASA can also provide technical assistance on this. And there also have been some materials developed by the Montgomery County Primary Care Coalition on this that I would be happy to share with others later, about how you can protect your client's data in the best way possible from search and seizure. Also, that leads us to human relationships. Your role in the human relationship with your clients has never been more important, because you're building trust and you're supporting them through a very challenging time. And so continue to focus and value that human relationship you have. Because even if you can't change the system today, by walking side by side on an individual's journey and knowing that they can support you makes a huge difference. Or knowing that you support them, pardon me, makes such a huge difference. Fifth, we look to social justice. As a social worker, it's your duty to change systems that perpetuate discrimination in the ways that you are able to, put your grain of sand on the beach. And this policy is an attack on working class families. It's soaked in racism and xenophobia. It is undeniable that this is a discriminatory policy. And so I encourage you all as social workers to take on that duty with vigor and passion. And finally, social justice and political action. So we're proud to take a stand, and let's join together. Part of what's so wonderful about being a social worker is that we do stand up for justice. And so this is your opportunity to continue to do so. So let's talk about how you can do that. First of all, join the movement. Protecting Immigrant Families campaign is a national campaign that is being led by NILC and CLASP. It's a coalition of hundreds of organizations like CASA, and many of those on this webinar likely have joined up. I encourage you to, on the next slide, I'll show you the link, but otherwise you can just go ahead and Google it and it'll take you right there. That's a wealth of resources to get some background, to get updates. There's information about educational materials, different language materials in about 7 different languages I checked yesterday. So it's really a wealth of resources. Also, get educated. So your first step is by being on this webinar today. Thank you so much for being here. So CASA is able to provide free community or agency trainings, and there's lots of resources online as well to get educated. Please do contact myself. I'll share my information at the end of the webinar. You can contact me to talk about setting up an in-person training with your teams. And we also have a team of trained health promoters who can go around the region and provide education for individuals and groups of clients and other community stakeholders. So we really want to encourage folks to get information, get educated about this policy, and let's correct misinformation. Also, spread the word. Anyone who will listen, please tell them about what's going on, because although it has hit the press, it's going to need to become a bigger issue for it to get stopped. So tell your networks about the harm this policy will do and get them involved in the work and inspired. Also, you need to raise your voice. The policy has not domestically been implemented yet. It could happen any day. But we have found that the fight that we've been fighting for the last year and a half against this, we believe that has made a big impact in preventing it from actually finally being implemented. And we hope that you can continue to advocate to continue to hold it off. And if and when it is officially implemented, raising your voice will be equally, if not more important. So this could look like writing letters to the administration and the White House, USCIS, or the Department of Health and Human Services. You can write op-eds to the local and national newspapers. Call your elected officials. You know, this is not a piece of legislation. This is an administrative rule. But your elected officials have power to influence and to set this back on track. We want it to be stopped. And so have them get involved. And also, we really encourage clients to speak out. CASA can do media coaching, and we can support them through the process. We can connect you if you'd also like to speak with media. We are working on our side to develop a cohort of media entities that are on the ready, and so we are looking for individuals who want to speak out against it, and we will support that process. And then finally, if and when the rule is finalized domestically, there will be a 30 to 60 day period to submit comments to regulations.gov. So anytime that a rule administratively for any agency in the federal government is published or changed, there's a public comment period. And that's essentially the time when the public can give feedback. And if enough feedback is provided, the government is supposed to reconsider their rule changes. And so we intend to enter millions of comments into regulations.gov when the time comes. CASA has already been organizing the community to do so. We have 300 members already who have committed to write comments. We hope that every single one of you today can commit to write a comment when the time comes, and your organizations can also do that. As much as quality of comment matters, quantity matters more. So we need as many comments as possible. But we believe that comments alone will not necessarily change the situation. We need to rise up with human stories and our advocacy at the same time. So finally, I just wanted to review again, the Protecting Immigrant Families campaign is an amazing resource that I encourage everyone to utilize. There are fact sheets there for providers and clients, there are policy updates, academic articles, and media coverage. Also, as I mentioned, I am available to come in person or via web to provide education or technical assistance if you want to talk about something specific or just get an overview of the public charge like today's webinar. I can make myself available and come to you. So now we will open up the floor for questions, and I'm just going to need about a second to figure out how to switch that mode. One moment. Okay, so I'm going to go through here. Can someone just confirm that you can hear me all right? Can everyone hear me all right? Okay, great. So let's see. So someone asked Is dropping out even worth it? Won't the government have a record of it and deny them anyways? Or are they only denying applications if they are actively enrolled in a public benefit? Great question, Jillian. So the answer is that as of the day that this rule becomes officially implemented, which has not happened yet domestically, that is when the clock starts ticking for assessing whether someone was enrolled in one of those benefits or not. So it is not worth dropping out at this point if you are concerned with, domestic processing. If someone has a family member that they are sponsoring from overseas to come, it could impact that family member's process if they're receiving Medicaid or one of the other programs on the list. Because that process, the public charge determination overseas, began as of January. And we're seeing more and more cases of denials because a U.S. family member has a public benefit or because the person who's trying to come from overseas at some point had received a public benefit. But as far as domestically, the policy has not been implemented and it won't be implemented, or public benefit recipients will only have it count against them in the public charge determination as of the day that it's implemented. Again, that doesn't mean people should necessarily drop out. And so that's where we encourage families to talk as a family, consult with an immigration attorney, and figure out if there really is a risk to them or not, and whether the risk is worth dropping out from really essential care. Okay, I welcome other questions. Go ahead and write in any other questions you have. So someone asked, when I say asylee, do I mean asylee upon entry into the U.S. or anyone who applies for asylum once they arrive to the U.S.? So this would apply for folks who are applying for asylum, because you are eligible for some public benefits when you are applying for asylum. For example, there's a point at which you can get a work permit and a social security number before your asylum is approved or denied. And so a family member could be, someone applying for asylum could get, an Obamacare health plan, a qualified health plan, or in certain states their children might be eligible for Medicaid, but that will not hurt their chances at becoming an asylee. And then after they're granted asylum, it also won't hurt their chances of becoming a permanent resident. I hope that answered that question. And that applies to the other group of humanitarian visa recipients that I covered in the slide. So great question, Karina. Do we have a timeline of when this change might be coming? I am so sorry that I don't have more detail. I would love to know. That is the golden question, actually. And so we've been basically suspecting that it could be released ever since February. That's when our radar went up, because multiple different drafts were being leaked. But since the March draft that was leaked, we haven't, other than maybe some back channels and certain entities that have gotten leaked drafts, publicly there have been no more leaked drafts. And so there's pretty much been silence since March. But then about 2 weeks ago, it came out in the press. A lot of information about this rule came out in the press and said that it would likely come out in the next few weeks, and that it was just going back and forth between USCIS and the White House and getting updates and revisions. So to be frank with you, I don't know the answer, and it could be any day. It could be in 3 months. It could never happen. But I would say that we do believe it will be released eventually. and we do believe it will be released this year. So the next question, you said that in addition to other categories, this change will not affect SIV. SIV is the acronym for a Special Immigrant Visa holder, and Special Immigrant Visa holders are individuals who have worked overseas with the U.S. military or other federal government agencies, and because of their associations with, for example, in Afghanistan and in Iraq, there were a lot of citizens of those countries who supported the U.S. military and other efforts, and in return are eligible to receive a special immigrant visa, and it provides them pretty much immediate permanent residency once they arrive to the United States. Okay, next question from Joe. Does the rule affect undocumented family children? So if the best way I can answer this, because each kind of situation and each family's opportunities for immigration processes really depends on a lot of specifics, but in general, if someone does not currently have a pathway to permanent residency or work permit, in this case their children, they wouldn't be applying for a work permit, but like some sort of permanent residency, then they essentially would not currently be affected. If in the future they have a family member who's able to sponsor them for permanent residency, or if the law changes and they are able to apply, hypothetically, it could affect them. Now, we hope that if we have comprehensive immigration reform and an expansion of pathways to permanent residency, that would also go hand in hand with a much more humanitarian and realistic approach to the individuals who would be becoming permanent residents. And so we hope that the public charge rule, would also change in accordance. And so these same families would not be punished necessarily. But that's all very hypothetical. So Karina asks, is it expected to affect unaccompanied minors who request special immigrant juvenile visa? So special immigrant juvenile, great question, Karina. A special immigrant juvenile visa would be under the category, I'm sorry, I didn't include it in the list. It would be under the category of exempt statuses that would not be affected because it is essentially asylum for minors. It's a humanitarian protected status. So they would not be impacted by the public charge rule. Let's see, any other questions? Keep them coming. So how about the parents of children who requested SIJS? So this is a good one. This is a little tricky. Our understanding is that in this case, with SIJS, in this case, would the parent necessarily be undocumented, or they would have to have some, okay. So in that case, it is our understanding that if the initial individual in the family who gains their status has some sort of, if that status is one of the ones that are exempt from the public charge rule, and then they go to sponsor their other family members, it's our understanding that if the child who has special immigrant juvenile status is receiving public benefits because they're legally eligible and they have that humanitarian visa status, their parents, when they sponsor them, would not be denied because the child had received public benefits. I hope that that's clear. Now, if the parent was able to regularize their status and then went ahead and sponsored, another family member, that they might have, they might have to be assessed for public charge, or be at risk of being assessed for public charge. But again, these are really tricky situations, and that's why I recommend an immigration attorney. Definitely consult with any families who you think might have complex questions, or or just have a complex situation where they really would just want to know what are the risks and or not. Okay. Javier says, for unaccompanied minors enrolled in department, I assume DVH's Department of Behavioral Health, to receive mental health support, is this service part of the public charge rule? Our understanding is that no. So what we have heard rumors of is that certain county and local subsidized health insurance and food assistance programs could be included in the list of public charge programs. Something like attending, mental health services at your local Department of Behavioral Health. We don't believe that necessarily would not be related to the public charge determination. If the person was accessing those benefits with health insurance, that was one of the health insurances on the list, then potentially yes. But just by simply accessing those services, it would not put them at risk for public charge. And I promise, once we get clarity about those localized and county programs, we will send that information out, and we'll send out a confirmation. Because up until recently, we thought that it only would be federal programs, but we did hear that they may be including other things as well. Any other questions?
Can you all hear me?
Yes.
Okay, great. This is Carol Aguilar with Social Workers United for Immigration, and I just wanted to briefly say hello and thank Lee, because if it hadn't been for her who joined our monthly call this month actually, we would have not had this on our radar. At least I didn't have it on my radar, and she joined the call and she kind of shared this, and we realized the urgency of this. So thank you, Lee, for speaking up about this and making sure that we have all the tools and information that we need in order to move forward. Everyone's welcome to join our monthly call. It's a quick call for an hour every Tuesday of the month from 6:30 to 7:30. And the idea is that we have people like you who are on the ground working on immigration to provide information that otherwise we may miss. And it's also an opportunity for us to know how to support you all that are on the ground working really hard with our community members. So I just wanted to say a quick hello and a shout out to Lee, because she's worked really hard to make sure that people have the right information and the tools that they need around public charge. So thank you, Lee, and everyone for joining today's call.
Thank you. So we still have some time. I spoke faster than I anticipated. We have about 15 more minutes. If anyone wants to send in any other questions, we can give it a couple more minutes, and otherwise we can let you go early. Okay, great. Well, we're gonna, I think I recorded the webinar, so we'll go ahead and share the recorded version through the network again, and we welcome you to share this. There's no copyright. You can go ahead and share it to whoever you like. And on the last slide, again, is my contact information, but I'm going to go ahead and send it to all of you as well right here. Figure out how to do that. Thank you all for bearing with me. This is my first webinar using this platform. Okay, so there is my email. I welcome you to reach out to me, and we can schedule upcoming trainings or visits, or have the health promoters come and talk with your clients and communities as well. And again, I encourage you to check out the Protecting Immigrant Families campaign. I'm going to go ahead and include that link right here. And there you will find a wealth of resources. You'll find, for example, some illustrated educational tools that are in a bunch of languages. If you just look at the resources tab and then scroll down, you'll find some that CASA created in French and Spanish, and there's at least 4 other language versions from different partners across the country that are also there. And you know, if you want to speak out on this or write an op-ed, there's lots of resources of data and studies, and that's also something, if you're interested in contacting an elected official or writing an op-ed or writing a letter to the administration in advance of the rule being officially implemented, I can be a source of support for that as well. I can copy edit, I can, you know, help you dig up data for your arguments, etc. So please don't hesitate to reach out to me and use me as a resource. And thank you so much.